guys, it's so good to see you again. So sorry for the scarcity of content. Medlife is tough stuff. Either see patients, eat, or sleep. And I can't not see patients, you know what I mean? That's no excuse for my lack of content. So, you might be wondering what's with the white coat. Well, I thought I'd start making content that's more relevant to my line of work. I'll start making more videos about health and medicine. So this first episode will be all about smoking. Smoking remains to be a rampant habit all around the world. There are approximately 1 billion smokers in the world as of 2014. 80% of the world's tobacco market comes from low and middle income countries, and an estimated 8 billion smokers are men, especially in Asian countries. 85% of smokers sadly start in their adolescent years. There are many factors that can influence someone to smoke. Advertising, availability of cigarettes, a family member who smokes, and peer pressure. The active ingredient of cigarettes is nicotine. This is a cholinergic, which means it's a drug that plays with your body's nerve fibers, stimulating your fight or flight response, causing high blood pressure, increased contractility, and high heart rates. This makes you feel very excited. At the same time, it stimulates your parasympathetic nervous system, stimulating acetylcholine receptors in your peripheral muscles, making you feel more relaxed. It's also what causes your brain to release dopamine, making you feel good. It's this that makes nicotine very addictive. An addictive substance is anything essentially that people crave so badly they'll go out of their way to get it, interfering with sane logical judgment and proper social functioning. However, for them, cigarettes also contain tar that messes with your lungs and respiratory pipes, as well as many other substances that can cause cancer. Some recent studies have shown that some patients can inherit nicotine addiction from their parents. Unfortunately, it's more difficult for them to get rid of nicotine from their body, and it's easier for them to become more dependent on the substance. They also have an increased tendency to develop depression associated with nicotine use, and it's also much more difficult for them to quit. Just because you have the genes for it doesn't mean you need to act on it. You can also make the choice to protect your lungs. There are generally two ways that people smoke: using pipes and using cigars. Pipes are generally heated, releasing a vapor with an alkaline pH. This allows nicotine to be easily released into the mucous tissues of your mouth. Cigarettes and cigars, on the other hand, have an acidic pH, which makes the nicotine much more difficult to absorb in the mucous layers of the mouth. But these are absorbed when you inhale deeper into your lungs. I mentioned earlier that smoking releases toxins into your body. Your body has natural mechanisms that repair mutations in your body when your cells go out of whack. However, the toxins in smoking cause your cells to mutate too much too fast for your cells to cope with. This causes all sorts of cancers in your body. This can cause lung cancer, laryngeal cancer,
oropharyngeal cancer, esophageal cancer, stomach cancer, kidney cancer, pancreatic cancer, liver cancer, cervical cancer, and leukemia.
Recent studies also show an increased risk of breast cancer. 40% of cancers can be prevented by stopping smoking alone. However, did you know that smoking can mess with your body in so many different ways, more than just cancer? Here are 10 diseases besides cancer that smoking can cause in your body. Buerger's disease, not burger, Buerger, is an inflammation of the small arteries in your body, more often in your arms and legs, but sometimes also in your head, your heart, and your belly. This is more often seen in Asians and Eastern Europeans. This happens when inflammation, caused by smoking, makes white blood cells to infiltrate the elastic layers of your artery wall. This causes a bump, causing stiffness and blocking your arterial canal. When you have Buerger's disease, you develop cramping pains in your hands and legs. as well as this thing called Raynaud's phenomenon, when your fingers and toes can turn black when exposed to the cold. This also results in migratory thrombophlebitis, or chances of a blood clot to form in the smaller blood vessels. Patients with Buerger's disease may have normal pulses in their feet, but more often than not, weak pulses in their wrists and elbows. And if the doctor asks a patient with Buerger's to make a tight fist, one might notice weakness and discoloration. Angiography, a special type of scan used to look at the insides of your arteries, will show tapering, or arteries becoming smaller and smaller. The diagnosis of Buerger's disease is confirmed by biopsy. Buerger's disease can be treated with medicines called calcium blockers to ease the blood flow in your wrists. But the best way to manage Buerger's is simple. Stop smoking. I had to fix my collar there. Aortic aneurysm is when the wall of your aorta, a big, long artery that goes from your heart down to your trunk, balloons and forms a tiny little pouch. This can be caused by conditions such as Marfan syndrome, Ehlers-Danlos syndrome, Turner syndrome, or, smoking. In an aneurysm, inflammation, again, causes white blood cells to release chemicals that break down collagen and elastic fibers in your aorta, making it weak. Since blood flow in your aorta is strong, the weak wall balloons out, forming an outpouching. Most of the time, this is asymptomatic, meaning patients won't notice it at first. It's often detected on physical exam, when a doctor feels your belly. In the chest, this can result in superior vena cava syndrome, when the aorta compresses on the major vein that carries blood from the head and arms. This causes congestion of blood flow, swelling in your face and hands, and difficulty breathing. In your belly, it can be more severe over time, and when it expands, it can cause strong, bounding, painful pulses. An aneurysm is a dangerous condition. When the wall becomes too weak, it can rupture without warning, resulting in really low blood pressure and, if not operated on time, death. In patients with aneurysm, beta blockers may be helpful and may decrease complications during surgery. However, if you don't have it yet, the best way to not get it is avoid smoking. Atherosclerosis is the major mediator of mortality in developed countries. It starts with deposition of fat inside the walls of your arteries because of arterial damage. This forms a low-density lipoprotein that causes oxidation. However, since this is in your wall of your artery, it's hidden from your body's antioxidants, causing the formation of toxins to build up. This recruits our old friends once more, the white blood cells. There is one specific type of white blood cell, the macrophage, responsible for swallowing enemy bacteria and chemicals. However, in atherosclerosis, the offending protein is a low-density lipoprotein, and human macrophages don't have the proper enzymes for digesting LDLs efficiently. The buildup of macrophages is called foam cells. This results once more in a disturbance of blood flow in your arteries. The buildup accumulates over a long period of time, and this may block your artery, resulting in stroke, heart attack, or even sudden death. Atherosclerosis is much more likely to develop in smokers than non-smokers. To avoid atherosclerosis, one has to change one's lifestyle by increasing activity, avoiding diets that increase LDLs, and yes, avoiding smoking. Stroke, a simple term for Cerebrovascular Disease, is the second leading cause of death around the world. It alone is responsible for 6.2 million deaths in the year 2011, and death by stroke occurs twice as much as heart attack in China. There are two types, ischemic and hemorrhagic stroke. Ischemic stroke is when a blocked artery causes poor oxygen supply to the brain. In a matter of seconds, the brain, starved of oxygen, will start to malfunction. Unlike the rest of your body, your brain is very inefficient at making energy in the absence of oxygen, and within 4 to 10 minutes, your brain cells will start to die. The panicky brain cells release glutamate, an excitatory neurotransmitter, which will increase inflow of sodium and calcium, speeding up brain cell damage. This is an emergency, and patients need to be given aspirin to allow the oxygen to flow through the squeezed arteries in order to reach the starving brain cells. The block needs to be given rapid tissue plasminogen activase, or RTPA, to break down the clot as soon as possible to restore proper blood flow. The second kind of stroke is a hemorrhagic stroke, where increased blood pressure or trauma causes the brain's blood vessels to burst, causing blood to bleed around the brain. Woo! That was a mouthful. The blood chemicals that are normally harmless when kept inside your arteries are toxic to your brain cells, causing cell death. At the same time, these can cause a block in your brain's cerebrospinal fluid, causing compression of your cortex and worsening blood flow to the rest of your brain. Hemorrhagic strokes often occur around the brainstem, which connects your brain to the rest of your body and performs your crucial vital functions. Patients with hemorrhagic stroke need to be given vitamin K and prothrombin to stop the bleeding and preserve what is left of the brain. Patients with stroke usually have one-sided weakness or numbness. This is abrupt in hemorrhagic stroke, but tends to be a bit more gradual in ischemic stroke. In hemorrhagic stroke, only 60% of patients manage to survive. To prevent stroke, one needs to have a lifestyle that reduces blood pressure and cholesterol. One can also avoid alcohol, amphetamines, cocaine, and smoking. Quitting smoking by 1 year alone already reduces risk of stroke by 50%, but 5 years will give you maximum anti-stroke benefit.
Quick, get your 5-year benefit now. Get no smoking at 1-800-NOS-MOKE. 1-800-NOS-MOKE. Get it while your years still last.
We've already discussed how smoking damages your arteries, and this is no different for your coronary arteries, or the arteries that supply your heart. Yes, your heart has needs too. Your heart has high oxygen demand compared to the rest of your body, considering that it's pumping like all the time. The mechanisms we've discussed earlier can also take place in your heart's own arteries, blocking your heart's own blood flow. This can cause myocardial infarction or heart attack and sudden cardiac death. Coronary artery disease often presents as pain in the lower chest or upper abdomen, radiating to the neck or to the left arm. Pain often occurs at rest with recent onset and with increasing intensity, frequency, and duration over time. Doctors call this crescendo. An ECG will either be ST elevated or non-ST elevated. This implies that your heart muscles are having a hard time repolarizing when your heart recharges after each heartbeat. If you're willing to wait a bit longer, doctors can also take blood tests. These will reveal increased troponin and creatine kinase, which are chemicals released by damaged heart muscle. Coronary artery disease is treated with a huge regimen of beta blockers, nitrates, aspirin, antiplatelets, and anticoagulants. But one big way to avoid coronary artery disease is simply this: to stop smoking. I hope you're seeing a pattern here. Prinzmetal Angina is not some new rock band. It's when your coronary artery starts to spasm because your heart muscle contracts too fast. Usually this is your right coronary artery, but this can happen in any or even all of your arteries. This is most common in young patients who are smokers but seem otherwise healthy. This often manifests in severe chest pain at rest with an otherwise normal physical exam. Diagnosis is made by chest pain along with ST elevation on ECG. Half of these patients will show atherosclerotic plaque and coronary spasm on angiography. Unlike other kinds of coronary artery disease, you do not give aspirin in a patient with Prinzmetal angina. You give nitrates, calcium channel blockers, and sometimes surgery may be helpful. But the best way to avoid this is stop smoking. Rheumatoid arthritis is inflammation of the joints of your arms or legs due to irritation and fibroblastic tissue. This occurs usually among patients between 25 and 55 years of age and plateaus at 75 years of age. This is more common in females than males. Cigarettes increase the risk of rheumatoid arthritis by 50 to 250%. Fibroblasts in your joints normally produce collagen, fibronectin, and laminin. These are simply the materials that keep your joint tissues together. Since you keep on moving all the time, you need to keep repairing the damaged tissue because of wear and tear. Your bursa, which is the membrane that surrounds your joints, is also filled with synovial fluid. This has hyaluronan and lubricin, which keep the joint motion smooth and viscous, cushioned. The membrane that encapsulates your joints is chock full of white blood cells. Again, when your joint is irritated, your bursa becomes inflamed, and the white blood cells begin to infiltrate your cartilage and bone. The white blood cells overstimulate osteoclasts, a cell that is in charge of taking calcium in your bone when your blood needs it. However, when these osteoclasts become hyperactive, these start eroding your bones, causing the joint pains. Inflammation usually occurs in the bigger joints of the hand and can cause problems like trigger finger and, over the long term, deformity of your hands. Patients with rheumatoid arthritis can have stiffness that lasts around an hour long, easing with physical activity. Lab tests may show increased white blood cells in the joint fluid, and joint imaging may reveal bone and tissue abnormalities. While 10% of patients will have spontaneous remission in 6 months, most patients will have progressive disease over time. A few patients will have severely erosive joint disease. These patients will be more prone to heart disease than the rest of the population. To treat rheumatic arthritis, patients are given methotrexate with either NSAIDs, steroids, or TNF suppressors. If a patient with rheumatic arthritis is a smoker, they should probably stop. Cataract is when the lens of your eye becomes cloudy and opaque, causing poor vision. This may be due to trauma, infection, diabetes, genetics, radiation, steroids, or smoking. The clouded lens causes poor light conduction. In your eye, the lens and the cornea are supposed to target images from around you smack dab on your retina, allowing you to see a clear image. But in cataract, the cloudy lens bends light the wrong way, preventing you from seeing a clear picture. Patients with cataract have poor vision, and doctors may see an absent red reflex, meaning that your retina doesn't light up properly when the doctor looks into your eye. Patients with cataract usually need surgery to replace their lens. However, if you don't have cataract yet, it might help if you avoided smoking. Bronchiectasis is when your airways are damaged by autoimmune mechanisms, or when your white blood cells, our good old friends, attack our own body tissues. Neutrophils, a specific kind of white blood cell, release elastase that damages the walls of our airways when these are irritated, causing enlargement. The tiny quote-unquote hair cells, or cilia, in our airways stop moving properly, causing buildup of mucus in our airways, resulting in persistent productive cough with thick, dark phlegm. When a doctor listens to the lungs of someone with bronchiectasis, they'll probably hear crackles due to the disturbances in the airways. Patients with chronic bronchiectasis have poor oxygenation that may cause nail clubbing, which is also present in lung cancer. X-ray will show enlarged airways, and CT scan will show signet rings in your lungs. This is usually treated with mucus-dissolving drugs, mucolytics, to help get rid of the irritants in the lungs. However, the best way to get rid of irritants is to probably make sure that they don't get there in the first place. Chronic obstructive pulmonary disease, or COPD, is irreversible airflow limitation caused by chronic bronchitis and enlargement of your air sacs. This is the third leading cause of death worldwide, especially in third world countries. Though a rare few cases are due to genetic causes, 90% are caused by... Can you guess? Sadly, this can also be caused by secondhand smoking. This is when you inhale smoke coming from the person who does smoke. Bad for him, it's bad for you. Win-win, or rather lose-lose. Lose-lose. Irritation in your lungs from smoking causes inflammatory cells to release, again, elastase that damages your air sacs. The damaged air sacs cause change in the shape of your lungs. Normally, your lungs are made of many tiny bubbles that increase the surface area, allowing maximal oxygen absorption. However, in COPD, the many tiny bubbles turn into one huge balloon because of the tissue damage. This reduces your lungs' capacity to absorb oxygen, diminishing the amount of gas your body can exchange. Air becomes trapped, so to speak, and your rib cage and diaphragm have to work double time for you to breathe. Most commonly, patients will have cough with phlegm and difficulty breathing over a period of months or years before they finally get a checkup. The difficulty of breathing will be more notable during day-to-day tasks like running, pushing a shopping cart, or even just going up the stairs. Patients will have low blood oxygen levels. A doctor may get the hint if a patient has breath that smells like smoke and nicotine-stained fingers. Patients can also have cachexia or muscle wasting due to chronic low oxygen, which is a poor prognostic factor for patients. That is simply doctor speak for it doesn't look very good. COPD is diagnosed with spirometry, which measures the speed and maximum volume at which air can fill your lungs. Patients may be given ipratropium or tiotropium along with beta agonists. They may also be given steroids, theophylline, and oxygen. However, the mainstay of treatment is none other than smoking cessation. Bonus round! Did you know that pregnant mothers who smoke can put their children in danger too? As we've said over and over, smoking can make it much harder for your arteries to deliver oxygen. This is no different for circulation in the uterus, which is the only source of oxygen for the unborn baby. Smoking can also cause spasm of uterine muscles, causing premature rupture of membranes, preterm delivery, low birth weight, infant respiratory distress, and sudden infant death. If by any chance the baby manages to survive all of this, one can still expect long-term developmental delay. So now you know a lot of the nasty things that smoking can do to your body. How can you quit? I don't blame you if it's hard. Smokers need several attempts before they can quit for good. What's important is that you go to your physician and ask for advice or referrals on how to make your strategy more effective. Doctors can prescribe one nicotine replacement and nicotine agonists and antidepressants that can reduce craving for nicotine. However, these are not without their side effects. Doctors can also refer for counseling and smoking cessation programs. It's also important that you tell your family and friends and ask for their help to support you in your journey to stop smoking. If ever you've tried to stop smoking, I commend you, and I want to encourage you not to give up. It usually takes 4 to 7 30-minute sessions over a period of 8 weeks of counseling for a patient to quit smoking for good. You have to understand that it's hard and there will be hurdles to get over. But if you get the right people to support you, smoking cessation is not impossible. References used for this video include Taule's First Aid for the USMLE Step 1 and Harrison's Principles of Internal Medicine. This will be the start of a series of discussions of health, medicine, disease, and similar topics. If you want to learn more about any of the diseases that I mentioned, or if you want to learn about any other disease at all, please let me know in the comments below. Please like this video and subscribe and ring the bell so that you can stay tuned for future updates. Remember, live life well because you only have one life to live.
Word of the day.
Buerger.
Na 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 na.